love. Like a feather falling from the blue sky, it twists and turns as it passes us by. Somehow it found us. Now we
Good afternoon, everyone. I'm Becky Wittes, Chairman of the Niagara County Legislature. Thank you for joining us live once again on LCTV as we give you our Niagara County COVID-19 updates. We're also currently streaming live on lctv.net and on 90.9 FM on your radio. I'm joined again today by our Director of Public Health, Dan Stapleton, who's going to give us some updates and answer some questions. But first, let me begin with a note on our updates. For more than 3 months or so now, we have been bringing you Niagara County's COVID-19 information on these live broadcasts. We started off by doing daily broadcasts and then scaled back slightly over time. I want to let you know that starting today, we're going to be going to a weekly broadcast. We'll be doing those on Mondays. We'll try and stick with the 2 o'clock time frame if we can. We chose Mondays because it seems as though the governor does make announcements sometimes on the weekends that have a big effect on our community, and oftentimes people are out and about with their families. They're not watching those briefings on the weekend by the governor. So we decided Mondays would be a good day to go with. And of course, we will certainly keep you updated via news releases through the media. We will update information on our Niagara County Facebook page as we have been doing, and on our Niagara County website, of course, during the week. If you're not following us on Facebook already, I would encourage you to do so. That is where we put out the majority of our information throughout the week. And of course, if something occurs, if there's a very big announcement that we feel that you need to know right away, we will schedule a broadcast on short notice to get that information out to you. So, Dan, with that, if you would start with today's updates, please, for our numbers.
Absolutely. We have 10 new positive cases today. It's 10 since Friday. Over 1,200 people have had positive and have resolved from being positive and are now done with their isolation. And that's an important number. 40 active cases right now that are positive, and none of those are in the hospital. That's an important number because we haven't had that since March, where we have had no one in the hospital who was positive for COVID. That's an extremely important number. 1,100 people have fully recovered. We think that's an important number as well. And once again, we have 89 deaths so far since the crisis began. We haven't had a death for a while now, but we continue to take that very serious, and our hearts do go out to the people who have suffered from that. But so far, the numbers are going in the direction we want them to go in.
Absolutely. And our Niagara County heat map has been updated again today for you. You can find that on niagaracounty.com at the top of the page in the COVID-19 banner. Again, this map does break down the positive cases that we've had throughout the pandemic to show you in what towns and cities those were occurring. We've had over 353,000 views of this COVID-19 map on our county website, so we know that information is very important to you, and we will continue to update that information as we get new numbers. Switching to testing, we want to tell you that according to the state COVID tracker, we've now had 31,785 Niagara County residents tested here for COVID-19. Again, you can find a link to that tracker at the top of our Niagara County website as well. And Dan, I know that the Niagara County Department of Health is now doing drive-through testing on Wednesday mornings. Can you tell us a little bit more about that?
Sure. We started doing that a few months ago, and at the time it was primarily for first responders, healthcare workers, pregnant women, but now it's been opened to workers who work on all the essential businesses that have opened. So that continues to be a good source of testing for us. We have a great relationship with ECMC, who does the testing for this, and we usually are able to get the results back within 2 to 3 days. So that's a great number. Continue to do it. Doesn't require a prescription from your physician. You have to pre-register. You can also call the nursing division at 278-1900. And they'll be able to schedule you for this drive-through. Once again, we're doing it by pre-registering so people can come in, be done quickly. You might be there 5 minutes, 10 minutes, and then you'll be able to go on your way. And the results come back very quickly. So that's been very successful, but we are opening now up to a number of essential workers.
Great to hear. And of course, we do have that list of Niagara County testing sites available for you on our website at any time. If if that county testing on Wednesdays is not convenient, you can go to that other list, give a call, find out what their requirements are, and pre-register for those events as well. So testing is, of course, giving us a pretty good idea of where our community stands across the state. Can you talk a little bit about the infection rate and where Niagara County stands? That's the other big number that we look at.
Yeah, extremely important number. You look at our infection rate, it's about It's been 3.9% since the crisis began, and that's been going down every single week, sometimes every single day, and that's an important number. We're less than half of what the state average is, excluding New York City. So it's a result of a lot of hard work from a lot of people, including the public. So once again, if we can continue to have that 3.9%, having it go down every single day is an important thing, and it's one thing that we're keeping our eye on, as well as the admission rate and hospitalization rate.
Right. And Dan, all weekend long, we've been reading about other states and some of the cases increasing significantly in other parts of the country. In fact, we've seen other states that have started to kind of backtrack on their reopening plans, shutting down bars and other businesses. Is this the beginning of a second wave?
No. Typically with a pandemic, you'll have a surge, if you will, an increase, a rapid increase, which is usually faster than the decrease. But until you have no cases, and you had that for weeks, you really don't expect a second wave. Second wave will come. You'll have a breather. You'll have some weeks where you don't have any cases, or very, very small amount, and then it comes back. The concern I have, and the concerns public health experts have, is what happens when it comes back. That second wave, typically much stronger than the first wave. It's mutated since the virus learns how to survive against the mitigation efforts we put in. So that second wave, we need to be prepared for it. We're already preparing for it, and we hope it's not as bad as it could be. But no, the states that are experiencing an increase in tests, no, that's not the second wave. That's just too quickly opening up, too quickly allowing crowds, too quickly to some of the things that you need to keep a handle on. Doesn't mean you can't open up things, but you need to do it smartly and not too quickly. And New York State, Niagara County has done that the right way, and the public has done that. It's all dependent on how the public does it. So we'll continue to keep an eye on it. We watch our daily numbers, hospitalization, infection rate. The infection rate on a daily basis, it hovers around 1%, which is a really great number. I think last week we had a number was 0.25%. Today we're, I think, 0.59%. So it changes. We expect that, but if you can hover right around 1, that's a strong and very good rate for us.
So seeing great work done here by our community, as you said, very important at this point to remember to keep that 6 feet of physical distancing, keep wearing your masks when you're out in public and you can't be safely distanced from people. We have put in a lot of effort, a lot of sacrifice. We want to see our businesses be able to open, to do so safely and to stay open. So really asking the community to keep doing their part like they have been all along and keep following those guidelines, which have proven to work.
Yeah, absolutely.
Right. So the other metric we watch very closely, Dan, of course, is the hospitalization rate. And last week we did see and talk about a slight uptick in that hospitalization rate. But if you take a look at the graph that's up on your screen now, it looks like what we saw was a bit of a blip on the radar, that, not necessarily a trend, and that we're back on track. Your thoughts on that?
Yeah, trends are the most important part of this. I have about 5 different graphs that I look at on a daily basis, with all of the metrics and the numbers that are really important to us. And the hospitalization was one that we were originally the most worried about, because we were worried about a surge for the hospitals that they couldn't handle. Our hospitals planned with us. They put in the precautions to make sure they could handle that surge. Thankfully, that didn't happen. But trends are really what we look at. We look at long-term trends. I really look at my trends on a few-day average, a week at the most, to kind of give us an idea. But the trends are the key important thing, and we look at those. Like I said, I have 5 different metrics I look at daily, and all our numbers right now are going in the right direction.
Very good. And the governor today, of course, stressed the point that New York State is not an island. We can certainly take all the necessary precautions here, but what's happening in other states can affect us here in New York. And that is certainly his justification for the quarantine on travelers that has now been put in place with other people coming from other states with higher infection rates than ours. And part of what he talked about could absolutely affect our schools in the fall in the reopening process. Have you been part of conversations locally with the schools?
Yeah, I've been having either calls or meetings with all the superintendents for every single school district in Niagara County multiple times. And I had just conversations with some of them this weekend. So they're looking at getting advice from me from what I think could happen in the beginning. And I talk about it more as preparing for what things could happen rather than saying this is what's going to happen. But we do it on a regular basis. Talk to them throughout this crisis. School isn't far away. We're talking 2 months away. So plans have to be put in place now. I've been meeting with all those superintendents, and they take this really serious. And we're looking at partnering with them in any way we can, because they tell me the very first thing is we need to make sure our students, our families are safe, and that's been their top priority. And we're working together on a daily basis.
Absolutely, and so many pieces go into play to keeping those rates down, keeping our numbers where they need to be so that we can do things like open schools.
Exactly.
And of course, we've been fielding a lot of questions about the travel quarantine guidelines. I'm sure as you have, I'm sure your office is inundated with calls at this point. Do you want to talk a little bit about that travel quarantine? I know there's a state website and things that people can use to get more information.
Yeah, the travel advisory is a quarantine that's imposed by the governor and by the state commissioner. It's not the legally binding quarantine that I do. All my quarantines are all signed off on. It's a legally binding contract. This isn't. This is called a voluntary. It's voluntary until you don't do it, and then it becomes involuntary and it's mandatory. But it's taken a lot of questions. The rules are different than what we typically do. I had a call this weekend with all of the health departments in New York State, including the State Department of Health, and we're gonna end up having the contact tracers that the state has hired. They're going to be handling the people who are quarantined through the governor's travel advisory. It's not something that I impose, so we're going to let the state people handle their quarantine. We'll continue to handle our quarantine, but we'll continue to be available for people who have questions. We'll continue to be there for people who are concerned. There's a number people can call on our website, on our Facebook page, if they have concerns about that. But we're making sure people understand that these are not people who have had tested positive and are positive. They're not. They're basically depending on where they are coming from or where people visited and when they come back. But it's serious in terms of it is a 2-week quarantine. It's 14 days. So people need to realize that when they go away, knowing there's a limit and knowing there's a travel advisory and then coming back, and we don't want people to be surprised when they can't work for 14 days. So it's something that's changing. New information came out today. It'll continue to come out every day. So we're just making sure we're there to give advice to the municipalities that have questions, for the employers that have questions, and for the employees. And we'll continue to do that. But it's very clear that it's a governor's travel advisory, not the local public health official.
Right, and of course a big topic of conversation on our regional control room calls as well, as you can imagine, over the last few days with people having questions, employers, employees, travelers, everyone has questions about specifics on how this will work, and there are guidelines on the state website that you can look to. They will list the states that are involved. Please know that those states can change based on the infection rates and what's happening in those other states. So if you have travel plans in a state that's not included now, you might want to check again over time, be sure that hasn't changed. And there are some things they can check out as far as exemptions for essential workers and some different rules that apply in those situations. So again, if you have any questions at all, please take a look at that guidance on the state website, and as we get more information here locally, we will update you accordingly as well. Well, thank you, Dan. I certainly appreciate all the information that you share with our viewers and pass along to us, and for your help. Continued thanks to your entire staff and your team for everything that you have done throughout this pandemic. We know that none of us planned for this and expected anything like this, certainly in our time, and you have done an outstanding job of helping to keep our community safe and healthy. So thank you.
My staff does it. They do a great job. They're well prepared, and our partnerships is what helps us do such a great job. Thank you for your support, though.
Thank you, Dan. Now, another announcement from the governor today, as we expected, is that the Western New York region will officially enter Phase 4 of the reopening process tomorrow, which is very good news. Phase 4 includes higher education, low-risk indoor and outdoor arts and entertainment, and media production. Now, as we have been all along, our economic development team has done a wonderful job of gathering all of these guidelines and information from the state and putting them up on their website for us for an easy place to find them. You can go to NiagaraCountyBusiness.com and click on the red COVID-19 button and find all of the guidance for the businesses that are already reopened through the phases, or those of you who are entering reopening in Phase 4. They're also there. The staff is answering phones at 278-6750. If you have any questions at all, they are there for you to assist. Please don't hesitate to call. They'll help you out with any concerns and questions that you might have. I want to remind everyone that gyms, movie theaters, and malls are not included in this portion of the Phase 4 reopening and will come at a later date. In fact, the governor talked today quite a bit about problems with air conditioning circulation and looking at state requirements for filter systems that might need to be in place in some of these industries before they can reopen safely. These filtration systems could potentially screen out the COVID-19 virus and make it safer for you to be in those environments. We certainly will attempt to get more clarity on this issue and pass it along as we hear it. We know that gyms especially have been a big one that have come up. Gym owners having very good cleaning and safety protocol guidelines in place that they feel that they could get opened up at this time, and we will continue to advocate for that on our regional control room calls. We do know that many gyms are holding outdoor training classes as they are allowed to do at this point, so you might want to check with your facility to see if there are options available to you that you can use. And again, we certainly recognize the frustration that the business owners are feeling who can't reopen. I know that they expected to be included in the reopening in Phase 4 tomorrow, and that was taken away very quickly last week, changing their plans, of course, as far as their employees and how they're handling their businesses. So again, please know that we continue to monitor the balance between getting our economy open and running, getting our businesses back, serving their clients and their customers, getting employees back to work, but we have to balance that, of course, with all of the safety protocols, doing that in a way that's healthy for not just the employees, but of course the customers and clientele coming to the business. And again, following all of the state mandates and guidelines that are put in place. So we will continue to update you on that topic as well as soon as we get more information. I want to remind everyone again, of course, about the Niagara County Crisis Hotline. That's 24/7 free and confidential helpline for you to call if you are struggling with anxiety, depression, substance abuse disorder, alcoholism, domestic violence, any of those things that people struggle with when times are normal or better that might really be just escalating right now with all of the uncertainty and everything that we're going through at this time. Please don't hesitate to reach out to them. Their number is 716-285-3515. Again, that's 24/7 free and confidential help. If you joined us late today, you can catch us later today on demand on lctv.net under the Niagara County Legislature tab. LCTV has been a wonderful partner during this last 3 months in helping us to get the information out to our residents, and we continue to thank them for doing so. And of course, all of the other stations that have picked up our broadcast and information as well. LCTV will also replay our broadcast today in their schedule as time allows, so you can watch for that right on your cable station. We'll see you again next Monday, but for now, everyone, stay healthy, Niagara.